Okay, so ready.
Lisa, thank you for being here, and welcome to our Hymns Hometown series here.
Well,
Uh,
thank you. It's a pleasure to be here.
Absolutely, I know all the things that you're doing with the REC. You're doing a great job, and I'm really excited about South Florida REC. And you're doing some really special things. For example, I know at one point you had an RFI out to look for partners to help finance EHR for physicians that couldn't afford it. Can you tell us a little bit about how that came about and where that is?
Sure. One of the things that we're really focused on in the South Florida Regional Extension Center is to address the multiple barriers that physician faces in EHR adoption, whether it's financing, whether it's training and education. And so on the financing side, we released an RFI asking banks to provide us with preferred terms so that physicians can purchase an EHR system and not have the preferred terms would be something like no payments until they reach their incentive dollars or pull down some of their incentive dollars, or to reduce the interest rate on the loan. We're having a community-wide meeting coming up in the next week with local banks to talk about and explore ideas on how they could develop additional preferred terms. There's a little bit of lack of understanding, I think, in the banking industry. They're accustomed to making loans for tangible items, hardware, servers, office space, cars, but an EHR application, I don't know that they have a full understanding of how that impacts a physician's practice. And some of that financing, our goal is that some of that financing may be used to offset the downtime. So for example, when the physicians deploy the EHR, our recommendation and best practice is that you don't see the total number of patients you historically see, but then what are you going to do if that offsets your revenue stream?
Sure, you're not billing as much, right?
Right, so hopefully we can incorporate in the loan agreement with the banks some capital, some cash flow so the physicians aren't jeopardized by not having that on a daily basis.
Wow, that's unique. Actually
Yes.
incorporating working capital
Yes.
into the whole equation so that they're not suffering financially from the lack of billing and lack of appointments that they're having while they go through that transition. That's very good.
We're trying to make that process as seamless as possible and as painless as possible for the physician and their staff.
And for the staff. Okay,
Yes.
great.
Yeah.
How about your self-sustaining model? There's a lot of discussion about self-sustaining models for the RECs, and we know that financing just recently got changed to the 90-10 for 4 years, right? So that's a great thing, isn't
Yes,
it?
yes.
But down the road, how do you see the self-sustaining models actually?
Well, the South Florida Regional Extension Center is a division of a parent corporation called Health Choice Network. Health Choice Network has created a sustainable business model by primarily providing IT services to federally qualified health centers for the last 15 years. So we actually have a presence in 9 different states, and through the deployment of both practice management systems as well as EHRs, we also provide billing services to the clinics, and those are service lines that we'll be able to offer the private physician office as well. In addition to that, we offer group discount purchasing so that as a physician, not only do you get a discounted rate on the EHR application that you're buying, but on the hardware as well, and also on clinical supplies and office supplies that you would use in
Really?
your normal everyday practice. Yes.
Okay, so you have a GPO program,
Yes.
and do you see any new offerings as a result of now being associated with a regional extension center, as opposed to the Health Choice Network side? Do you see some new offerings coming?
I do. We're
Don't give
playing
away any
around.
secrets. Don't give away any secrets.
We're playing around with a couple of ideas because, again, our goal is to help the physician better manage his practice. The physicians are the healers.
Yes, they are.
And information technology is only a tool. And so how can we use that tool to create additional revenue streams for the physician, manage that practice, so the doctor can do what they've been trained to do, and that's to heal and take care of patients.
You know, I really like what I'm hearing because you did not mention incentives at all.
Yes.
You've actually mentioned, you know, using the EHR as a tool for their business as opposed to do it so that you can get money back, right? And don't you think that we really need to adopt that type of philosophy in order to move adoption through and not just, hey, here's some incentives?
I would totally agree with that because the incentive dollars, although well intended, are just in some cases a small drop in the bucket in the investment that a physician may have to make in the long run. So you look at any type of investment that you put into your business, and a physician practice is a business. What is your return on investment? How can I create additional revenue? So we're putting together some ROI tools so that as we go into the physician practice and look at their volume, maybe where there's some opportunities for practice management improvement to improve their bottom line.
Okay, great. Well, thank you for your time.
Thank
Appreciate
you.
it.
Thank you
All
for
right.
inviting me.
You're welcome, Lisa. Good seeing you.
Yeah, you
All
too.
right.